Hello, what is that pain in your neck? People ask me this all the time. Dr. Ashley Oxner here, doctor of chiropractic. Been doing this over 20 years. One of the most common conditions we see and treat. There are three basic fundamental causes of neck pain. I'm going to talk about those today under the umbrellas of this. One, muscular tension. So we got muscle issue. Number two, soft tissue injury. So that's muscle, tendon, ligament, or all three were injured somehow. And then we have spinal joint, disc, nerve-related issues, which I'll go into as well. So let's get into this. I'm going to talk about each in depth, then I'm going to go through solutions, most importantly to help you or that person that you're watching this video for. So when we look at muscular tension as the cause of it, where it's just muscles, a lot of times that's typically due to stress in the brain. So the more stressed you are in the brain and your body responds to that, it kicks in what's called the fight or flight. So it goes into fight mode where the muscles go into tension. So as your stress continues and you allow stressors to not be processed, eliminated, and filtered through your body and your system mentally, you get stressed and strained. So key is understanding that and not forgetting that. Number two is just over time, really poor posture, especially with sitting. If you sit a lot at a desk or you use a device like a phone or whatever that might be, where your head's down constantly, posture is another issue that over time can deal and cause issues with the muscular tension. Okay, so that's number one. Number two, when we look at soft tissue injury, I'm going to go a little more in depth, show you a couple animations on this one, but typically what people think of with soft tissue injury, they're thinking of concussions, whiplash, and things like that, car accidents, football, soccer, etc., which all do obviously cause this type of injury. Repetitive use, though, is more and more common now with refreshing back on devices, computers, as we just sit and do this thing over time. We're starting to see more and more of these neck issues and upper back issues from repetitive use, repetitive posture injury. So making sure that we have that correct. We'll talk about solutions momentarily. But let's go into concussive forces or whiplash type forces. I want to show you first what that looks like a little bit from the side, because what happens here, you're going to be looking at the neck from the side. I'm going to show you ligament damage that occurs after either a concussive force or a whiplash type force. So take a look at this. This is the person looking back and up, so arching their head backwards. You're going to notice that when they do so, see that what's called the anterior longitudinal ligament, big word for super long ligament that goes down the front of the spine. I just drew an arrow where it was damaged from that type of a concussive and whiplash type force. Now that that ligament has been overstretched and we have ligament damage, notice this joint right here and the space there and how it really slides backwards. That's a problem that will lead to multiple other issues, including that disc wearing out right there, inflammation, scar tissue will form around that. You can have a host of issues that then can turn into radicular pain, things down your arms, tingling, and stuff like that. So it's key to recognize if these forces have happened recently or even in the far past, that we get them corrected of any of the damage that's there currently. That's important to understand. Third, when we talk a little bit about spinal joints, I want to go to a different animation and show you this one that I saw on YouTube of literally looking at spinal decay over a process, over years. So think about all the stresses, whether they're physical, mental, emotional, whatever, that accumulate over time, poor posture, whiplash injuries, maybe you just have a heavy head that's forward, devices, text, and you can watch this neck begin to change. You see, this is nothing more than forces over time. It's like geology, really. It's force over time causes change. So forces over time of gravity, weight, physics cause this complete and total breakdown, and we start to get what we refer to as that old man posture, that nursing home posture, whatever you want to call it, that hump on your back. So key to recognize that can be avoided. You can correct damage that's already present and then avoid it and do things to offset it. So that's kind of the umbrellas, the three buckets, if you will, of causes. So let's go through solutions. When we talk muscular, massages are great. However, they're pretty reactive, right? We want to talk about the stress that's bringing it on. You need to allow your body to manage that stress. Drink green tea, meditate, allow and create a body that can process stressful situations and events big time. That I can't stress enough. If it's posture over time, doing some basic stretches. This is when we show our patients all the time. Just some extension of the neck, applying a little bit of pressure at the top. Do the doorway stretch, then do the opposite. Stretching like so. You're going to reach out like this. So you're going to see me reach out. That's going to stretch in between the shoulders. So doing just stretches to offset that gigantic when we talk about the muscle issue. When we get into soft tissue injury, this is where we get a little more extensive, and you're going to really want to consider further evaluation and then a specifically designed rehab protocol and some corrective care most likely. We'll talk about that momentarily. And then same thing with spinal joints, discs, nerves, and those types of issues. The big mistake people make is they forget, and a lot of chiropractors take this approach, where gravity has pressed down, concussive forces have caused injury. We need to instill opposite forces. So we call these traction forces this way with the spine instead of rotatory forces and making it spin more. So we want to stretch and traction your spine, helping that rehabilitation process, keeping the disc hydrated, stopping degeneration. That's where the difference is when we talk about doing approaches that are corrective in nature versus just treating the symptom, okay? So getting the right care for whether your neck pain is coming from muscles, a soft tissue injury, and or a spinal joint, disc, or nerve issue is critical. I highly recommend a complete and thorough evaluation. In fact, things like even ligament damage that I pointed out, we can now locate via certain x-ray studies. We do motion study x-ray in this clinic so that we can absolutely diagnose if there is ligament damage. We can see where there are bones locked up and joints not moving right. We do functional work to get you back living the life of your dreams. So don't let this neck pain hold you back. Find the cause, come on in, click the button to request an appointment. We'd love to see you here and try to help you, okay? Have a great day.